So much technology, so little time, especially for sleep. But the number of hours you sleep or don't sleep has a profound impact on your physical and mental health, and it can directly affect those around you. Joining me are my guest, family therapist David Peters and Dr. Atul Malhotra, pulmonary critical care chief at UC San Diego School of Medicine and director of their sleep center. Welcome, gentlemen.
Thank you.
Dr. Malhotra, two sleep conditions we often hear about are sleep deprivation and sleep apnea. How are those two different?
So sleep deprivation refers to people who get inadequate sleep in a 24-hour period. Most of us require about 7 or 8 hours of sleep in 24 hours, and if you're sleeping 5 or 6 hours, you're probably sleep deprived. People with sleep apnea often snore at night, and they have stoppages in breathing, which can affect their health. Many of them will come to the doctor complaining of sleepiness or other things, but sometimes you have to ask the doctor and prompt them to get the right diagnosis.
And I understand sleep apnea can be a serious condition, but there are also health conditions that cause sleep deprivation, correct?
Correct. There are different diseases. One is called restless leg syndrome, with an aching pain in the legs that can make it difficult for people to sleep. People with sleep apnea will stop breathing, and they'll have to wake up from sleep in order to start breathing again. So their sleep gets very fragmented. They get tired during the day. But when they stop breathing, their oxygen levels can fall as well, and that can take a toll on the heart and other organs.
And David, now you have dealt with people with sleep deprivation issues, and you've also done quite a bit of work with teens that have this issue. What are your concerns with teens and sleep deprivation?
Well, frequently we have teenagers who are doing poorly in school, their behavior's out of control, their ability to focus is very poor, and they're misdiagnosed as having attention deficit hyperactivity disorder or depression. They're given medications, psychotropic medications, or they're blamed by their parents. And really the problem is they're not getting enough sleep. Teens need more sleep than adults, and they usually have a sleep cycle that starts later in the evening and runs later in the morning, and we have them getting up very early in the morning to rush off to school. And sleep disorders or sleep deprivation among teens accounts for about 1/3 of their behavior problems and their focus problems at school.
So we need, you said adults, 7 to 8 hours. Teens need more than that.
9, sometimes 10.
Sometimes 10 hours. But let me ask you this, David. So most of us know, whether you're a teen or an adult, you get kind of cranky if you don't get enough sleep. We've all experienced that pretty much. But you've actually said it can directly affect your relationships with people at work or at home. How so?
Definitely so. We have to remember that sleep is not about rest. It's about brain maintenance, and it's our brain that falls in love. It's our brain that maintains relationships. I worked with a couple once where they had been in marital strife for several years. The wife was ready to leave her husband. She said, "This is it. It's our last chance." They'd had couples counseling. He had been treated with an antidepressant. He had had individual therapy. Nothing worked. But after interviewing him in detail, I realized he had restless leg syndrome. I sent him to his doctor. He got medication for that. He came back, and the wife said, "Our marriage is fine. I've got my husband back."
He got a good night's sleep, several good nights' sleep. Dr. Malhotra, you said adults should get 7 to 8 hours of sleep per night. How do you determine if someone's actually not getting enough?
Sometimes it's based on their symptoms. So they feel tired during the day, and occasionally they'll come in saying, "Doctor, I'm falling asleep at the wheel," or "I'm falling asleep at work," and the problem is that they're just burning the candle at both ends, not sleeping enough at night. But there are lots of people that misperceive how tired they are as well, or they drink cups of coffee and can stimulate themselves to stay awake. They're still getting inadequate sleep, and so sometimes you have to dig a bit deeper in the history.
In treating this, I know you don't just give medications right away. Could you kind of walk us briefly through the steps of what you would do to treat somebody who has sleep deprivation?
Sure. If somebody's not sleeping adequately at night, the first question we ask is why. And some people it's because of behaviors, and since they're burning the candle at both ends, they're working 2 jobs, they have young kids that are waking them up, and those are things that you need to be aware of and address. There are some health behaviors that can affect people's sleep as well. So alcohol, tobacco, caffeine, these things can all keep people awake at night. Sometimes just staring at the alarm clock can be a problem. Sometimes people taking a nap in the afternoon can make it hard to sleep at night. Sometimes just stimulus control, so people use electronic games or different technology that can wake people up or be alerting in terms of the bright light, and just taking those things outside the bedroom can be quite effective.
And in fact, you bring up some good tips. The American Academy of Sleep lists some tips for better sleep, and they include avoid daytime naps, minimize light, Get up at the same time every day, even on weekends. Establish pre-sleep rituals like you were talking about, and avoid using your bedroom for activities such as work. So in all of these tips that you just talked about and all these things we're hearing about, where would you start?
Often it starts with a conversation with your doctor. So you talk to them about what your symptoms are exactly. If the problem is snoring or excessive daytime sleepiness, then often a sleep study or some medical evaluation is worthwhile. If people are simply sleep deprived and they're not sleeping enough, just being aware that this can affect your health can be enough to have people make lifestyle choices that will give them increased sleep. If they really have insomnia, then sometimes you need to address these issues of sleep hygiene and more aggressive therapy.
So much more we could talk about. We have a lot more on our website, kpbs.org. Dr. Malhotra and David Peters, thank you so much.
It's good to be with you.
Thank you.